Let's go step by step. First, we calculate the total daily insulin dose called TDD because every further calculation depends on this baseline. We use body weight. For most patients, it is about 0.5 units per kilogram per day. So if the patient weighs 60 kg, TDD becomes 0.5 into 60, which is 30 units per day. Now we divide this into basal and bolus because the body has two different insulin needs. So basal is 15 units and bolus is 15 units. Now initially, we divide the bolus across meals. So 15 divided by 3, we get 5 units. But remember, this is only a rough starting estimate, not the final dose we give. We use this estimate only to begin safely, especially in new patients. Now we move to the next step because meals are not the same every time. Carbohydrate intake varies, and carbohydrates are the main factor that raises blood glucose after eating. That is why we calculate the carb ratio to match insulin precisely to the food. Carb ratio is calculated using 500 divided by total daily dose. Here it is 500 by 30, which is about 50. This means 1 unit of insulin covers 15 grams of carbohydrates. Now, instead of giving the fixed 5 units, we individualize the dose based on what the patient is actually eating. If the patient is about to eat 60 grams of carbohydrates, meal insulin becomes 60 by 15, which is 4 units. Now we move to the next step because even before eating, glucose may already be high. If we give insulin only for food, we ignore the glucose already present in the blood. That is why we calculate a correction dose. Correction is calculated using the 1800 rule, which is 1800 divided by TDD. So here, 1800 by 30 gives 60. This means 1 unit insulin lowers glucose by 60 milligrams per deciliter. Now check the patient's current glucose. If it is 180 and the target is 120, there is an excess of 60. So correction dose becomes 60 by 60, which is 1 unit. Now we combine both parts because two problems exist at the same time. There is incoming glucose from food and existing elevated glucose in blood. Meal dose is 4 units, correction dose is 1 unit. Now we arrived at 5 units through proper calculation, which will change depending on food and glucose levels. So total insulin before this meal is 5 units. Notice something important here. The initial estimate also gave 5 units, but that was just a guess.